I'm here to share with you some of my thinking and the critical ideas I feel are important as you study looking at advocacy for education. My name is Dr Mhoira Leng. You'll see a slide in a moment with my designations, but I've been involved as a global palliative care specialist physician in advocating for and implementing education at all sorts of levels, at undergraduate, postgraduate, in-service, from PhD to community training. And I've been doing that for the last 3 decades and in 4 continents and 15 countries. So I'm hoping to distill some of that, and I hope it will be useful to you. I'm going to base some of my experience around starting an academic program here in Kampala, Uganda, where I am right now. I'm a UK trained specialist, but I've been here for the last 13 years, and initially talk about the steps of advocating for education in an academic setting. I'm also going to link this to something that I feel is really critical, and that is transformational learning, and I'm going to come back to that. Some of the ways in which I've learned and been involved in learning over the years, from my childhood in the jungles of West Papua and to many other ways that I've had the privilege of being engaged. You see here Gaza, India, Sudan, Uganda, and colleagues from across Africa But I've also had the privilege of being the first lead for palliative care within one of Africa's leading universities, Makerere University, building on experience of what's happening already in Uganda, for example, with Hospice Africa Uganda, but focusing particularly on the national hospital setting. And you can see our mission there. And you can see also this group, which was our 10th anniversary. So how do you do this? How do you get palliative care into the heart of an educational institution? I'm going to talk you through some principles, and then we'll see how we can discuss those in practice. So here's my really critical points. You need to be credible. If you yourself are not credible as an educationalist, as a specialist, you may need to get higher qualifications. You may need to make sure your training looks good. We may know in palliative care we can do this, but do we look like we can to others who have gone through their own processes of credibility and professional training? Is what we're offering relevant to that setting, or are we bringing in something from another setting that will not be relevant? And maybe you need to partner then on the ground to make sure it is relevant. Thirdly, be willing to get involved. When I met the head of medicine in Makerere University, she said to me, we want people who will get involved in our department and not just come in and want to teach one course. You have to understand the curriculums are busy, they are overfull. Is there a way in which you can contribute? For example, I'm involved in examinations for undergraduate and postgraduates. We're involved in supervising at master's and PhD level. We're involved in curriculum development and learning. And that has earned us the right, if you like, to talk more about palliative care. You have to underpin all of this with excellent clinical skills. And so you're demonstrating what you're talking about. If you don't do that, everything you're talking about will fall. And also you need those young clinicians to see in practice what you're talking about. We know that that kind of mentorship makes a huge difference to anchoring learning into practice. Find the right champion. For us, it was the head of the Department of Medicine. So that's where we sit. Somebody else might sit within a cancer department or a family medicine department. I personally don't think it matters, but you need a champion, someone who is already credible inside that institution that is going to support you. And I think for many of us, the Department of Medicine is one of the most powerful in the university settings. Work with the opinion leaders, both in your department, in your setting, in your region, and make sure you're on board. Start small. We came in as just a few lectures, and then we got into a course which was in the postgraduate, was with critical care medicine. In the undergraduate, we built on what was there already, but we developed it over years 3, 4, and now 5. So start small and go for the long game. It may be the people you train now are going to be your major advocates in the future. I am now seeing MMeds, that's postgraduates in internal medicine, who are now our greatest advocates when it comes to discussion of where to go from now, and for example, how we might develop even into further specialty training. So find those people that you're going to mentor and build and aim for the long game. Provide evidence. Do that in a research way, including your colleagues. We even researched our colleagues and found out what they felt they needed, because they said, why are you training everyone else, but you haven't trained us? And make sure you give feedback, and if possible, publish what you're doing. Ensure high quality, and this is appropriate whether you're training people in the community or elsewhere. High quality, and I mean that with the second point being generous. I mean, let's get the best we can. Let's make sure we're innovative and creative, and we use digital formats, and we show that actually this is something incredibly relevant and innovative and interesting. And be relational and persistent. You know, we started within the Department of Medicine, but we now are teaching postgrads in surgery, in psychiatry, in ear, nose and throat, in gynae-oncology, in hemato-oncology, in, I think I mentioned family medicine, of course, in other areas where we're working with colleagues such as Hospice Africa, Uganda, to develop BScs and masters in palliative care. But one of the things that made the ENT surgeons send their students wasn't all of my talking above. It was they were doing ward rounds, and they found that their patients were no longer crying in pain. We'd trained some nurses on their ward. We'd been involved with that, and they wanted to know why. Yeah. We've trained nurses who have made a difference on the ward, such that their bosses have come to us and said, this work is ours now, not just yours. Come and tell us how we can do this more. We trained leaders that have gone on to be significant in the nursing field, in clinical officers, in community-based training, and of course in the medical training that I mentioned. And all of this is transformational learning, something that speaks to the values and the heart of who we are and why we do what we do, what it means to be human, and into the heart of what it means to be suffering and to come alongside those who are suffering and bring palliative care, bring dignity, bring respect, bring relief from suffering. So engage those who we're working with. Our patients, our colleagues are our best advocates. And remember transformational learning. I'm going to make a separate small video to talk more about what I mean by transformational learning. Thank you very much.